A woman is losing so much blood right after having a vaginal delivery. There is a medication to save her. The hospital has it, but she will not receive this life-saving medication if her husband doesn't raise the money to pay for it.
Thank you.
This is in spite of the existence of the free maternal health care policy that declares the entire 9-month journey completely free. Francisca Angel takes you undercover to expose the agony of pregnant women in hospitals, a pay or die phenomenon at the Korle-Bu Teaching Hospital, Kaneshie Polyclinic, and the West Municipal Hospital, popularly known as the Amasaman Hospital. This is a part 2 of similar findings at the 37 Military Hospital, Mamobi General Hospital, and the Mamprombi Hospital.
What's register insurance and also 5 city.
I'm going to register insurance.
I'm going to register insurance and also 5 city. It's got that I hear get them 7 year car 2 city. They say I'm going to be full of any assigning with them from Paka.
Hey.
This is the reality of financial struggle of the poor referred from the various health facilities to the premier hospital in Ghana. We begin this undercover work at the Korle-Bu Teaching Hospital to capture live this victim's ordeal as it unfolds. The premier referral hospital averagely records 5 infant and maternal mortalities in a month.
How many infant and maternal mortality do you record averagely in every year?
2 for the mothers. Babies, yes, about 10 or 20 in a month.
What do you think that could be contributing to this high number of mortality in infants and mothers?
Sometimes not assessing antenatal care early, or yes, even sometimes when they are referred, they stay behind till in the critical stage before they come.
So not assessing antenatal care early. Have you never heard of women saying Municipal Hospital?
They do.
Antenatal.
Yes, sometimes they do. Sometimes they will tell you maybe the husband is not giving the funds to go to the hospital, the partner, or they even start the antenatal care, but along the line, if they don't have the finances, they decide to stay behind.
In spite of this, the hospital and its staff have placed barriers in the way of access to maternal health care. Pregnant women do not enjoy the free maternal health care policy in the premier hospital.
We can say that antenatal health care is quite expensive, particularly here in Korle-Bu.
Not if you have the health insurance, at least it helps.
So over here, if somebody has the national health insurance, what would the person benefit?
It covers all the services that she's giving here,
including scan, labs.
It doesn't cover scan. Some of the labs it covers.
Here, antenatal care is given at 2 different units of the hospital, the Gynae OPD and the maternity unit. The Gynae OPD only accepts pregnancies below 12 weeks, and the maternity unit accepts pregnancies that are 12 weeks and above. It was found during this investigation that NHIS card-bearing pregnant women were required to pay 105 Ghana cedis 20 pesos for a folder at the Gynae OPD to begin antenatal, and pay 17 Ghana cedis on each antenatal visit till after the 12 weeks where they move to the maternity unit.
Yes, they said we should come tomorrow, so I just wanted to know how much it would cost. That 105 20 pesos with health insurance.
First time health insurance will not cover, but the subsequent
visits. Oh, okay. Thank you. The subsequent visits, 70 per visit.
At the maternity unit, pregnant women pay some official and unofficial charges. The unit officially demands payment of some 5 Ghana cedis. You are not told what exactly you are paying for, but every single woman attending antenatal is made to pay this amount on each visit. You are directed to pay at the bank and submit the receipt as proof to the nurse before you can enter the consultation room for your antenatal care. This payment is classified as antenatal maintenance fee on the receipt. Also captured was the demand for some payments by health workers directly to themselves without issuing receipts. These payments included 5 Ghana cedis as cost of covering the maternal health record book with a rubber. As well as the demand for the payment of 15 Ghana cedis at the counseling room after HIV, AIDS, HB and sugar tests.
Hello. Counseling room. Yeah. What's the near payments?
HIV test, HB sugar, HIV test free. HB sugar no better 15.
Oh, okay.
In a follow-up interview with Corruption Watch, the Chief Nursing Officer of the Department of Obstetrics and Gynecology at the Korle-Bu Teaching Hospital, Mary Anderson, she acknowledged officially charging the antenatal maintenance fee, but said it was a management decision.
Only 5 cedis if you have the national health insurance. But if you don't have, you have to pay 20 cedis. So at least you are helped some way.
But that 5 cedis, what does it cover?
The 5 cedis I'll say is for maybe processing, the papers and things. That's what they pay for.
And they pay
We do it, yes.
This hospital, the free maternal health care policy isn't working.
Like I started by saying, here is a tertiary institution. So before they put in any measure, they seek approval from the central government.
She, however, denied knowledge of the 5 Ghana cedis unofficial charge by the nurses.
We noticed that pregnant women are being given some rubber to cover the book at a cost. Are you aware of that?
That's why I'm not aware, because we are not supposed to take any monies from any patient.
And the 15 Ghana cedis taken in the counseling room. According to her, all tests conducted at the counseling room are fully covered by the NHIS.
HIV is free. HIV syphilis is done freely.
Okay.
For all pregnant women.
What about the HB?
The hemoglobin level, it's covered by the national health insurance. So if the patient has, fine, she needed to pay.
Oh, okay.
Yes.
At the Korle-Bu Teaching Hospital, we were charged 70 Ghana cedis for an ultrasound scan. At the central lab of the Korle-Bu Teaching Hospital, pregnant women covered by the NHIS are charged up to 142 Ghana cedis as cost of running the list of laboratory tests.
So maternity, right? Insurance will cover for 1, 2, 3. So this, and that. So you
covers which one? Malaria,
sickling, and then routine RE. It's 2 RE.
So which one are we paying for?
We pay for this.
What's that? Which one is it? What does it?
This one is just a speed.
What's that?
Blood group. When you go to blood bank, you will pay. Then you have the antigen. This one is 31 cedis.
What's that?
Hepatitis B antigen. This one is urine RE.
Urine RE.
49 is just a speed. HBS.
That's hepatitis B, right?
Yeah,
That one is how much?
31.
31.
Urine RE 27.
So this money, the blood group is not like.
The blood group had like 30 cities, around 30 cities. I know it's around that.
Wow.
Blood bank is here. In front of this story, the 2-story building there, in front of it.
Then I'll go and find out the price. Then we do the rest here. All of them. HB test. Blood group. Okay, I have no pregnant? What time? Thank you. And are you already down with 35 cities? 35 cities. What was the change? Oh, you changed here. But we have insurance. Insurance doesn't work here. Insurance doesn't work here. Wow. That's like insurance.
According to Mary and Darshan, all those charges are management approved, and those approvals have the backing of the Ministry of Health. The magnitude of unlawful charges for delivery varied depending on how normal or complicated the delivery was, which informs what goes into the delivery. At the Korle-Bu Teaching Hospital, pregnant women with NHIS cover are charged 400 Ghana cedis and above for spontaneous vaginal delivery, while delivery by CS cost 1,500 Ghana cedis and above for NHIS holders. The premier hospitals appeared to have some similar practices, like a strange phenomenon of NHIS not covering any drug in the pharmacy of the maternity unit. The difference though is, at Korle-Bu Teaching Hospital, important drugs are administered on the pregnant woman when it is needed, and she is then billed to pay for the drugs during discharge. The hospital, however, gives prescriptions to escorts of pregnant women to make some other purchases elsewhere. Aside the drugs, lab tests and scans are paid for on a cash and carry basis. This investigation established that the Korle-Bu Teaching Hospital renders neonatal intensive care unit (NICU) services. NHIS holders are charged for the care. Every NHIS covered woman whose newborn is admitted at the NICU of Korle-Bu is charged a fixed amount of 410 Ghana cedis and 20 Ghana cedis for wipes. Despite having paid the fixed charge, lab tests and drugs are paid for on a cash and carry basis by the parents. Mrs. Adokobia said the practice is not right.
During delivery, everything is covered.
We continued this investigation at the Ga West Municipal Hospital. Staff of this hospital exploit the vulnerability of pregnant women and their desperate families. They see delivery as profit-making opportunity, cashing in on the poor and vulnerable with strange and insensitive charges like other income. At the Ga West Municipal Hospital, popularly called the Amasaman Hospital, a scan cost 30 Ghana cedis. Dr. Eric Sapon Tiamwa, the head of the Ga West Municipal Hospital, said scans requested by pregnant women are not covered by NHIS in his facility, but scans medically requested are covered.
To have a scan done, it costs 25 cedis.
25 cedis?
Yes.
Is it supposed to be free or that's the...
It depends. Per the National Health Insurance package, the first scan that you do, because that time it has not been confirmed that you are pregnant, it's not done for free, you pay. Yes, so it's confirmed that you are pregnant, you're entitled to another scan which we also do for free. If you come in voluntarily, we'll explain to you and then you do it at a cost. Some people come, I want to know the sex of my baby. This is not NHIA approved. So if you come in with such a request, you will pay.
The staff at the scan room stated clearly that NHIS is not accepted in her unit. At this hospital, pregnant women are denied free laboratory tests. The group of lab tests requested at the beginning of antenatal which are supposed to be free under the NHIS, cost 60 Ghana cedis at this facility. All other subsequent labs are equally not free. Dr. Sapon Chiamwa said NHIS does not cover all required laboratory tests. Hence, those covered are given for free, while the others cost 30 Ghana cedis.
The NHIS has bundled the services. We are on the bundled services, and routinely there are 8 labs that a pregnant woman needs to do. 8 tests. Some of the tests are covered by NHIS. I should say the majority of the tests are covered by NHIS. Some are not covered. HB, it is covered. So if HB is requested, it is covered. For the full blood count, it is not covered. It's not part of the bundle. A test like hepatitis B, which is also a very key requirement. It's an infectious disease. The mother may pass it on to the child. It's a key requirement. It's not on the bundle. G6PD is not on the bundle. So we give the bundled ones for free, and the ones that are not part of the bundle, you pay a small token for it. So, for instance, G6PD, hepatitis B, and then full blood count, the FBC, we take a token of 30 cedis.
Dr. Chris Opoku-Fofie, head of Safe Motherhood Program at the Family Division of the Ghana Health Service GHS, states that the GHS is actively working according to the free maternal health care policy, which is binding on these health facilities.
The position of the service is that all that is illegal and should not be condoned. We are promoting access under the universal health coverage, and we want as many of our women to access antenatal care. So once you say you are pregnant, the doors are open for you. So anything that is done as a barrier to put a hindrance in the way of our pregnant women is unacceptable, and we don't really sanction that.
This hospital also makes available the drugs at the antenatal unit. These drugs are given for free. Some drugs are also paid for. At the Gan West Municipal Hospital, despite the facility officially claiming that both spontaneous vaginal delivery and cesarean section are free, this investigation established that delivery is not free in this hospital.
It's your own receipt.
What's the doctor receipt? Our ward fund. The ward fund how you cheer. And you need receipt. One, we don't get time massive. Two, nationality and your woman bill. Then you're coming into any ward fund you're doing none your child here. And so you don't receipt for home.
I'm the one to receipt.
That's what you're doing, receipt.
Okay, Matthew.
It's in the glass of the sun. The last year, I don't know the time myself. And then you want to know what the hospital. What family receipt? So, Metrama. One part of our day. When you work for me, you have receipt. And when you work for me, you have work. And you have receipt. And you are not going to get clients to Diana. I don't say for receipt. I do not pay receipt. Metrama, one part of our day. You need to go. By a work for me, you have receipt. Metrama. And I said,
Bring back for receipt. And then
I said, but what family, and then you need receipt our water, and you know the seat.
Should I do the money?
And 15 by a ward family, my card and no fat and a photograph. And some other card.
Pregnant women are required to budget for more than 500 Ghana cedis to take care of the cost of delivery, drugs, lab tests, charges like assessment, other income, discharge and ward fund among others. The most critical health needs are paid on a cash and carry basis. We concluded the investigation of the 6 health facilities at the Kaneshie Polyclinic. This facility officially charges pregnant women 35 Ghana cedis for ultrasound scans. This amount is paid each time a scan is medically required.
Consulting one, which has come. Now, I'll channel the other way.
But anymore. Just when it's our bank for not Marino. Is the pool outside?
Okay.
After that,
I have health insurance. Please.
It's the same price.
With the health insurance?
The medical director of the facility, Dr. Stella Jamfi, admitted charging for scans, but she said she was not aware that scans were part of the free maternal health care entitlement.
We, with the scheme, we've had conversation with the scheme, and they did not tell us that free scan was part of the package. Okay. So they've been paying.
Mrs. Vivian Adokobia, Deputy Chief Executive Operations at NHIA, disagreed with the claim, adding that there was no justification for claiming lack of awareness.
About 90% of their IGF is from the National Health Insurance. So most of them, they take interest, so they know what the benefit package entails. You'll be given the operation manuals, you'll be given the medicines list, you'll be given the claims, the tariffs you'll be given. So I don't see any reason or justification for somebody to say that I'm not aware.
Dr. Chris Fofie, GHS, details laboratory tests required during pregnancy and the NHIS entitlement.
The full blood count, fasting blood sugar, GCSPD.
Which of them is covered by the National Health Insurance and which of them is not?
All of the tests are covered by health insurance.
All the tests?
All the tests, the basic ones. The ones that are not covered by health insurance are specialized tests like genetic tests.
HB test is covered?
Yes, it's covered by health insurance, yes.
The sugar level?
Yes, all that.
It's covered?
Yes.
Routine exams, is it urine?
Yes.
It's also covered?
Yeah, it's also covered.
Then routine exams too?
Yeah, the stool array is also covered.
It's also covered by health insurance?
Yes. Hepatitis B.
Is it covered?
Yes, it's all covered.
At the laboratory of the Kaneshie Polyclinic, the staff frequently announced that some of the compulsory tests pregnant women are required to undertake are not covered by NHIS. Hence, All pregnant women are required to pay 40 Ghana cedis for the tests not covered.
Main did you lab it over? It's happening for lab. Main did you? So more than the 40 Ghana come back. Insurance cover here. Some health insurance. Insurance cover here. So the 40 account gaba.
Dr. Stella Jamfi disclosed that all lab tests are conducted for free for pregnant women as required by the policy.
Fasting blood, they do fasting blood sugar, they do VDRL, they do urinary, they do stool RV, they do blood group, they do sickling, they do GCSPD on NHIs, and they don't pay a dime. NHIs have approached that several times to clarify with us about lab.
Okay.
So the lab are done free.
Since when?
Since I came here, at least. Since I came here, and then the lab in charge also was transferred in a few months after I came here.
Okay.
Yes.
It's completely free?
Yes.
However, the head laboratory technician Ebenezer Nku responded to the contrary. His response confirmed the findings of this investigations, which is the payment of 40 Ghana cedis.
In charge made us aware that since 3 years ago, the lab test for pregnant women has been completely free. Is that so?
Yeah.
Completely?
Completely. Unless other tests that health insurance does not cover.
The list of tests given to the pregnant women by the midwives, are there any of them that are not covered by the National Health Insurance?
Yes, hepatitis B. Okay. That one they pay 10 cedi for.
Which other one?
And then they pay for full blood count.
Okay.
The rest are free. They are covered under the health insurance.
The pharmacy of Kaneshie Polyclinic makes claims of non-availability of drugs covered under the free maternal health care policy. Drugs that pregnant women are made to pay for are, however, always available. They refuse pregnant women drugs like folic acid, a drug used to treat or prevent folate deficiency anemia, help unborn babies' brain, skull and spinal cord develop properly, to avoid development problems, birth defects and miscarriage.
The first one, second one, it doesn't come. We don't have the first one, the second one, it doesn't come. The first one, it comes. The first one is finished, the second one we have, but it doesn't come.
And how much is that?
13.
Although the pharmacist claimed folic acid was not available, the medical superintendent disclosed during an interview that the facility had enough folic acid in stock from September 2019 till date, an indication that at the time of our investigation, the facility had folic acid, but the pharmacy failed to give them out to pregnant women.
All the pharmacist had told and asked him which one of the hematinics for the pregnant women were available, because I was told because the framework issue some of them. He gave me this, that from 2020 to date, Fesolate has been available at the pharmacy. From September 2019 to date, folic acid has been available at the pharmacy. And then Multivite 2 has been available from, it has never even run out to date.
Okay.
Right? So they have been there.
What we encourage mothers or subscribers, what we encourage them to do is that they should insist that if you are charging me for this, I need a receipt. In that case, what should she use the receipt for? We have you should report to us. We have the numbers that you can call, and we have people who receive the call, then they will follow up, or you can also follow up. We have recovered some monies and given back to people. We have recovered monies and given back to people. They are not supposed to be charging. It is a worrisome situation. So I think we all have to come together and fight this. It is not right.
The policy we inherited was cynically described as cash and carry. That is, if you are not well, you go to hospital and don't have money. Even if you are lucky to get a doctor that would examine you and prescribe. It will be just a sheet of paper given to you, signed by him. Go and find the medicine. If you can't buy it, you go and die. The cash and carry. And we said no. That shouldn't be the thing for the people. So we really worked to introduce the National Health Insurance Scheme. Along the way, we also added the free maternity care.
SDG Goal 3.1 targets the reduction of the global maternal mortality ratio to less than 70 per 100,000 live births by 2030. It further aims to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortalities to at least as low as 25 per 1,000 live births. According to the 2019 UN Interagency Group for Child Mortality Estimation, UNICEF, WHO, World Bank, UN-DESA Population Division, the infant mortality rate of Ghana is 34 deaths per 1,000 live births, and Ghana's maternal mortality rate is currently 308 per 100,000 live births according to the GHS. Although the infant and maternal mortality rate has been declining since the introduction of the free maternal healthcare policy, the margin of decline hasn't been different from the margin of decline in the years before the introduction of the policy. For Ghana to meet the SDG Goal 3 target, the policy formulators as well as those at the point of service delivery must ensure that the free maternal healthcare policy is made to work fully to remove barriers and expand access to maternal health care. Francisca Angel's report.